there was this drug called Ayush 64, right? So in the early 1980s, they had done some clinical trial. It was developed by one of these Indian government labs. They held a comparator clinical trial with chloroquine, which is a standard of care for malaria. And chloroquine cured all the patients. This Ayush 64 barely, I think, cured about maybe 50%. And even those 50% could have been people recovering themselves. Now, modern science would tell you that this drug is a failure, right? So you continue giving chloroquine. But as we narrate in the book, when there were outbreaks of malaria in many parts of the country in the 90s, the government was shipping these guys Ayush 64 tablets. And then again during COVID, Ayush 64 made a comeback where these government labs repurposed it and said that you can use it to cure COVID. And there were government ministers who were going out in distribution drives and handing it out. That isn't good science. Good science is a randomized double clinical trial, blinded on both sides, and you follow the results and accept what happens. A third point I want to make is a lot of Ayurvedic medicines that you guys consume today are not even Ayurvedic medicines. Because what sells mostly in the Indian market is what is called patent and proprietary Ayurvedic medicines. These are not cures that were, originally written down in the old ancient texts. The government has basically allowed these guys to make new concoctions and sell them in the market. Originally, these they were not even sold as drugs. They would be sold more as supplements. So, for example, immunity booster or general anti-aging.
So they don't go through the regulatory rigor of...
No. Yeah, because what's changed in the last 10 years, about 8 years, is that we're not sure what happened in the government, but these labs started tying up with private Ayurvedic companies and started selling cures for very serious diseases, diabetes being one of them, right? Arthritis. Like these are all serious medical conditions. It's not like, say, anti-aging or herbal stuff, just immunity building stuff. This stuff has serious consequences, which means these drugs should have been rigorously tested, and that never happened. Which is what opened the door then to Coronil and Baba Ramdev during the pandemic.
The second is, why do we have a Ministry of Ayush that has spent 17,000 crores of your and my tax money? And if you dig deep into this, the regulations that actually govern what is sold for these things, they don't even come in comparison to what happens with modern medicine. Yes, there's a lot of problem with modern medicine. I admit it. The regulator is corrupt, incompetent. But there is a set of regulations. They don't know how to enforce it, or they don't want to enforce it. When it comes to Ayush stuff, there are no regulations. The government says you don't even have to test them for efficacy before you put them on the market. So then how do I reconcile with what Abhinandan said, which is basically, I take this stuff, it makes me feel better. Right? There are tons of us. I don't know how many of you do, but there are lots and lots of people in India who buy this. You know who's litigating on behalf of Ayurveda? Rickert Ben Kaiser. You think Rickert Ben Kaiser is an Ayurvedic company? They are the one who's litigating in the courts to try and prevent the courts from imposing stricter guidelines on advertisements. Rickert Ben Kaiser they're capitalizing because this market exists, right? How do I reconcile the fact that Abhinandan feels better when he takes Ayurvedic medicine? What goes for Ayurvedic medicine? The answer to this is the difference between anecdote and science. This country, in 1940s, had a scientist whose name was P.C. Mahalanobis. He was the father of the sampling strategy that became part of the basis of NSSO, which this government has hollowed out now. This country gave the world the ability to do sample size determination, to be able to say what our census would be, what the metrics of this country's progress would be. How did we come from understanding science based on sample size and figuring out what it does to individual anecdotes saying, I feel better because I get to take, this concoction, by the way, that concoction, Abhinandan, when you think about Ayurvedic medicine, the time that Ayurveda was practiced, there was a Vaid who came to your house, who looked at your nadi, and he made a churn, or concoction, and he gave it to you. Where do preservatives come in? When you go to buy stuff that the Baba Ramdev makes, you think that the stuff survives for months on end without preservatives in it? Who's testing for those? What interactions the preservatives are going to have with the concoctions that they're actually selling? We have no regulatory structure in place to test for it. So everybody goes happy.
If I can give you a scarier answer, Abhinandan, a lot of Ayurvedic medicine is also seriously adulterated. A lot of doctors report that, usually adulterated with steroids, because steroids give you immediate relief because they suppress the immune system. A lot of them are adulterated with nimensulide, modern-day painkillers. And if it's a Ayurvedic sex drug, you're going to have the ingredients of Viagra in it.
That's not the one I was referring to. I was talking about for my skin and hair.